Hi, everyone. My name is Sandy Cruz. I'm a registered holistic nutritionist, a podcaster, and I'm a certified metabolic balance coach. Today, I am going to talk to you about intuitive bioidentical hormone therapy. Yeah, this is really my own term. And I'm going to preface this by saying I'm not giving you any medical advice here. Speak with your own practitioner on what's right for you. And yes, I am fighting a cold, but this was so important for me to talk about because I think that advocating for what's best for you as a bio-individual person is really important. So I'm going to actually break down a couple of things. I'm going to try and make this as short as possible as it relates to hormone therapy. I've spoken to enough doctors, and I actually have a certificate in hormones and endocrinology for nutritionists. So I know a little bit about this. And I also lost my thyroid at age 41, and I'm 53 now. So yeah, I know a little bit about how hormones work. I also know that women in menopause are really underserved. There was a big article that was released, I don't know, maybe a month or two ago. And it really relates to how women suffer for a long time. I've spoken to a lot of medical obstetricians and professionals in this area. And the number one myth that I am going to challenge as a bio-individual woman who is going through menopause is that you have to wait 1 year before you start hormone therapy. Now, what that means, and this is according to many studies that are coming out now, is that you suffer for a longer period of time. You may not be sleeping. You may be dealing with severe hot flashes and other issues. So you're suffering for that whole year. The doctors that I have interviewed say that that is a myth. This whole wait 1 year of no periods before you start any hormone therapy, it's a myth. Okay. So I challenge you to go and challenge your physician if you are suffering. Okay. It's number one. Number two, the type of hormones matters. All of those studies that everybody has heard about, Women's Health Initiative, that big study where women had breast cancer because of supposed HRT, they were using synthetic hormones and Premarin, which is I think it's the horse urine, not bioidentical to our own in the study. So the type of hormones matters. And you need to know what you are taking. Is it progestin, which is a synthetic version of progesterone, or is it compounded bioidentical progesterone, cream, capsules, whatever it is? Know what you're taking. It's so important. And then the third thing I'm going to talk about is understand that even if you're a woman in menopause, your hormones, you still have sex hormones. It's just that they're not being produced by your ovaries anymore. They're coming from your adrenal glands, which is another reason why you really have to have healthy adrenal glands to have healthy levels of hormones, sex hormones. So if you think that all women, let's say I'm 53, that all women of 53 produce the exact same amount of estrogen and progesterone, you're going to be wrong because we don't. So I started to take progesterone a long time ago, at least 4 years ago. But on March 4th, I added in bioidentical estrogen. So I'm taking the cream, and it's typically recommended that you do only cream with estrogens, especially. So the cream that I'm using is an 80% estriol, 20% estradiol, bioidentical. Okay. And I started on March 4th. And after about 1 week, I started spotting. I'm like, oh, crap. And I started to have some of the symptoms. Oh, and the other thing I want to note is any woman who is taking hormones, hopefully bioidentical, you should be taking something that is protective for how you metabolize these estrogens. So I take sulforaphane, which is an extract from broccoli. I do that. And it's protective because it helps you metabolize your estrogens in a healthy way. So they don't go down that not so great pathway that could lead to those estrogenic type cancers. I forgot to mention that. Now back to the spotting. So I started spotting. I started having symptoms like sore breasts, all of those things. I'm like, okay. I went off for a week and I was actually spotting even more when I was off everything. So it was kind of like a little washout period just to make sure I wasn't having a period. My last period right now, it's April. My last normal period was actually in December. So not that long ago. So I was actually spotting. Then I went back on again. Then I tried to go off estrogen one night and stay on progesterone, off both for one night, stay on progesterone. Nothing was working. So I was bleeding right up until April 9th or April 8th. And then I thought, I'm going to start doing something more intuitive because I know that my body is not producing the exact same amount of estrogen and progesterone every single day. This is why women are unique. We are unique. Everybody's unique. Nobody's like exactly the same. We don't all produce hormones the same amount, same time. This is why I'm a big believer in this intuitive BHRT, intuitive bioidentical hormone therapy. And remember, I'm not a doctor. You have to speak with your own physician. And a lot of doctors are going to be afraid to do this with you because it doesn't go against regulatory methods. So find a good doctor that will work with you. So April 9th, I actually took progesterone only. April 10th, progesterone only. And guess what? After 2 days, I completely stopped bleeding. Then April 11th, my body said it needed progesterone and estrogen. That was April 11th, 12th. Those 2 days, I took both. Then April 13th, progesterone only. Then April 14th, progesterone plus estrogen. April 15th, progesterone plus estrogen. 16th, 17th, progesterone only. And you're probably thinking, what the hell? What is she doing? Muscle testing, my friends. Muscle testing. It's very powerful. And it's my body saying, yes, I want this tonight. No, I don't want this tonight. More to come on this. And I just wanted to give you a little heads up. If you want to learn about muscle testing, listen to episode 158 with Dr. Bradley Nelson. I just put that out. He talks a little about muscle testing, and I'm going to talk more about that. Bye for now.